Good day everyone, my name is Jerome Degamo, base cream alpha 1. I'm going discussing the artificial and natural methods. Oral contraceptives. Contraceptives are hormone containing medication that are taken by mouth to prevent pregnancy. They prevent inhibiting ovulation and also to preventing sperm from penetrating through the cervix. The advantage of using contraceptives is a safe, simple, and convenient way to prevent pregnancy. It also has other protect like reducing acne, making your periods lighter and more regular, and easing means trial. And disadvantage, it can increase your blood pressure. It does not protect you against sexually transmitted infection. The most common side effects are spotting or bleeding between periods. These are common with progestin-only pills. Sore breast, nausea or headache. Transdermal patch is a patch that attaches to your skin and contains medication. The drug form, the patch is absorbed into your body over a period of time. Advantage of using transdermal patch are simple to use and can usually be applied indefinitely of male. One particular advantage is physical presence of the patch on the skin. And disadvantage of using this is the variation in inter and intra-individual absorption of drug applied to the skin. The side effects while using transdermal patch are rash, redness, blurred vision, and colored images. Vagina ring or Nova ring is a small plastic ring that you place inside your vagina. It releases a continuous dose of the hormones estrogen and progesterone into bloodstream to prevent pregnancy. The advantage of using vagina ring, you don't have to think about every day or each time you have sex. The ring isn't affected if you're sick, vomit, or have diarrhea. It may help with premenstrual symptoms. Period time, bleeding usually becomes lighter more regularly and less painful. And disadvantage, you may not feel comfortable inserting or removing it from your vagina. You can have spotting and bleeding in the first few months. The side effects of using a vagina ring are increased vagina discharge, headache, nausea, breast tenderness, and mood change. Subdermal implants. The contraceptives implants is inserted beneath the skin of the upper arm. The implants release the progestational hormone to prevent sperm from reaching the egg. Advantage of subdermal implants include long-time contraceptive action without requiring the user or provider attention, low dose of highly infection contraception without the use of estrogen, and fertility is reversible after the removal of implant. Disadvantage, you may experience temporary side effects during the first few months like headache and mood change. The side effects of subdermal implants are many complications have been associated without subcutaneous contraception, including menstrual disturbance, headache, weight gain, lower abdominal pain, hair loss, loss of libido, pain, and the implant side. Hormonal injection. The hormonal injection prevents pregnancy by injecting the synthetic version of the hormone. Progesterone called default, midrophy, progesterone, state, and DMPA or DNPA. The injection is also called DIFO, prevent the body from producing its own hormones and releasing egg from the ovaries. The advantage: you'll likely have lighter periods, reduced periods, pain, and less premenstrual symptoms. And disadvantage of using hormonal injection, your periods may change and become irregular, heavier, shorter, lighter, or stop altogether. This can carry on for some months after you stop the injection. And also the side effects can include weight gain, headaches, mood change, breast tenderness, and irregular bleeding. Intrauterine device is a small contraceptive device that is put in the uterus to prevent pregnancy. Advantage: it protects against pregnancy for 5 or 10 years depending on the type, and the disadvantage: your periods may become heavier, longer, or more painful, though this may improve after a few months. Side effects of using the intrauterine device are spotting between period, irregular period, pain when you go load is put in, and cramping or back axis for a few days after. Chemical barriers methods are basically spermicides, which come in several forms, are used inside the vagina to stop sperm before it can make its way into the uterus. Advantage of chemical barrier: safe to use while breastfeeding, and disadvantage of barrier methods: prevent pregnancy only if you use them every time you have sex. Side effects: barrier methods of birth control can include an increased risk of developing urinary tract infection or UTI. Diaphragm. Our cup is a circular dam made of thin, soft silicone that inserted in the vagina before sex. It covers the cervix so sperm cannot get into the bump uterus to fertilize an egg. Advantage of diaphragm: you only need to use a diaphragm or cup when you want to have sex. Disadvantage: or diaphragm can be hard to use correctly. Some people have trouble inserting the diaphragm, and it can take practice to get comfortable doing it. Side effects of diaphragm are from the spermicide, irritation of the vagina and surrounding skin, or an allergic reaction, of higher risk of urinary tract infection or cause bladder infection. Cervical cup keeps sperm from entering the uterus by covering the cervix. From added protection, spermicide is put into the cup before inserting the cup snugly over the cervix. Advantage: the silver cup protects against pregnancy for 2 days, 48 hours, and for multiple acts of intercourse within the time frame. Disadvantage of silver cup is more difficult for women to learn to insert and remove than the diaphragm. Side effects of cervical cup: an allergic reaction to the material in the cup, strong odors, or vaginal discharge if the cup is left in too long. Male condoms: hold the tip of the condoms between your finger and thumbs to make sure it put on the right way around and no air is trapped inside. The condom will split if air is trapped inside. Place the condom over the tip of your penis while squeezing the tip of the condom. Roll it down over the length of your erect penis. Advantage of using male condom: reduce the risk of spreading sexually transmitted infection including the human immunodeficiency virus HN, and for the couple using another method of birth control. And disadvantage: some people embarrassed to use condoms or feel the interrupt foreplay or intercourse, and some people are allergic to latex rubbers. Condoms may break or leak. Condoms have no side effects. Most people can use condoms with no problem. These are no side effects. Rarely latex rubber condoms. Female condoms: while holding outside of condoms at close end, squeeze of inner ring together with your thumbs and forefinger and insert into vagina. Advantage of using female condoms: help to protect both partners from CTI, including HN. Disadvantages are they can slip out during sex, they can irritate your partner's skin. Female condom is no serious side effects. Surgical methods. Procedures for family planning include that ligation for female, sterilization, and vasectomy for male sterilization. Advantage of surgical methods: it's very effective in preventing pregnancy. It is considered a permanent method of contraceptives. Disadvantage: it requires a minor surgical procedure. Side effects: there is a small risk of hematomia and or infection after the procedure. Calendar methods or the redeem calendar. Redeem methods, also called the calendar method or the calendar redeem methods, is a form of natural family planning. To use calendar methods, you track your menstrual history to predict when you're ovulate. Advantage: the calendar methods provide the contraceptives protection which is as effective between 1 to 7 days of the menstrual cycle, and from days 20 to the commencement of next period of menstrual bleeding. Disadvantage: is not as effective in preventing pregnancy as other birth control methods. There are no physical side effects. Natural methods. Abstinence. Sometimes people use abstinence as birth control to prevent pregnancy. Abstinence prevents pregnancy by keeping semen away from the vagina so the sperm cells in the semen cannot get to an egg and cause pregnancy. Advantage of abstinence: it protects people against STD from vagina sex, and the disadvantage of abstinence: people may find it difficult to abstain for long periods of time. Abstinence is that there are no negative side effects like there can be with other birth control methods. Basal body temperature can be used as a way to predict fertility or as a part of a method of contraception by helping you gauge the best days to have or avoid unprotected sex. Advantage of basal body temperature: helping you gauge best days to have or avoid unprotected sex. Disadvantage: may not accurately predict ovulation in all women, including those with irregular menstrual cycles. Does not have any side effects. Cervical mucus method. The cervical mucus method is always to identify fertile time to help you gauge the best days to have or avoid unprotected sex. Advantage: to help you to gauge the best days to have or avoid unprotected sex. Disadvantage is does not protect against sexually transmitted disease. Does not have any side effects. Symptothermal methods: a fertility awareness method used to predict when a woman might be fertile. The method uses body temperature and after signs and symptoms of ovulation. Advantage of the symptothermal method: has significant advantage and effective because it combines the calendar's cervical mucus and temperature methods. However, this techniques share disadvantage that is of this technique has individually. These methods are associated with side effects, including the mood change, weight gain. Ovulation detection. Home test is used by women. It helps determine the time in the menstrual cycle when getting pregnant. It's most likely. Advantage: detecting the surge in it helps predict when you will ovulate. Disadvantage: limited detection. Side effects: some people experience signs and symptoms of ovulation. Side effects of ovulation: some people experience symptoms of ovulation. This can include abdominal pain and breast tenderness. Coitus interruptus prevent sperm from entering the woman's vagina, thereby preventing contact between spermatozoa and the ovum. Advantage: some benefits of coitus interruptus are that the method, if used correctly, does not affect breastfeeding as is always available for primary use or use a backup method. Disadvantage regarding coitus interruptus: as a contraceptive involves the ejaculatory fluid that appears after the penis becomes erect. A few drops of the semen containing sperm may be deposited into the vagina without the knowledge of either partner. Side effects: some couples also feel that the withdrawal disrupts the sexual pressure.